is. And it's so rare about this is that you know, breast cancer in men is only 2,000 cases a year, 2,100 cases a year. Mm-hmm. Most of my colleagues are clinicians, so there was a great deal of shock because it was breast cancer, because they're not anticipating that either, even though they're clinicians themselves. I'm getting reaction from people in the industry, which is very nice. People that I've worked with for many, many years who have heard about it, who've called or have offered their support, and it's a great thing. I mean, breast cancer is breast cancer, and the treatments are pretty much the same whether you're a man or a woman. But all the material, all the publications, all the material, all the support documents are geared towards women.
Male breast cancer accounts for 1% of breast cancers. The reality is that there are other breast diseases that men deal with, and that can be quite common. Gynecomastia is actually very common, but is something that needs to be dealt with. And those men have to undergo mammograms and ultrasounds. So you can imagine, even in a breast imaging center, how probably even more uncomfortable that may be for them. So Staten Island, out of all the boroughs, has the highest percentage of breast cancer cases. There's no particular reason that we have come to understand for it. I know many people want to blame our Staten Island dump or landfill, but in reality, although there is research to determine if that is part of the environmental problem, at this point that hasn't been established.
Doctors don't look for breast cancer in men, so the signs may have been there, but they weren't thinking breast cancer. And so I spoke to her about it, and I said, you know, would it do some good if I went public with this? And would it make physicians and men more aware that, you know, when they have signs like this, men ignore lumps and bumps, and doctors don't correlate the same symptoms they see in women. When doctors are alarmed because they believe it could be breast cancer, they don't think breast cancer. The same symptoms, they don't think breast cancer in men.